Heidi Bjornson-Pennell for our next panel, The View from the Rare as One Network. And for those of you unfamiliar with the network and project at the Chan Zuckerberg Initiative, this is a key area of focus for them. We're so appreciative to have you here with us today. And maybe if you'll just start off with a little bit of an introduction about your background, what brought you over to the Chan Zuckerberg Initiative and this project that they have.
Thank you so much, Julie. I also just want to call out NORD for their tremendous contribution to the rare disease field and the patient community. We're so grateful for the work that you do and your partnership. And also, I just wanted to thank our opening speakers, the patients that both spoke, for sharing their stories. I personally know how hard that is to do, and I'm really grateful for you. And we just all need to be listening to these stories all day long, to be honest, because I think between the two of them, they highlighted so many critical issues that we need to be addressing. So thank you. Julie, okay, to answer your question, I'm Heidi Bjornson-Pennell. I'm a senior program manager at the Chan Zuckerberg Initiative. I lead the work with the Rare as One Network. I actually began my career as a lawyer. I was a barrister in England and doing human rights work at a very interesting time in the EU, and really loving my career, and moved back to the United States and was working as a public defender when I, throughout that time period, had 3 young children, all very close to one another in age. And 2 of them ended up being diagnosed with the rare disease, primary ciliary dyskinesia, which is somewhat similar to cystic fibrosis, which more people are familiar with. At the time, we thought that PCD was significantly rarer than cystic fibrosis. We've now come to understand that it's actually far more common than previously believed. There's approximately 50,000 people in the United States suspected of having the disease, although less than 2,000 are diagnosed, and that's after considerable effort from the work in my children's disease area to improve diagnosis in this space. So I left my career as an attorney, like many women and men. It's a real economic issue, actually, and social issue, to join the board of the foundation in their disease area and to try to work to transform the landscape. As I said, there were very few patients diagnosed at the time, almost no research taking place in the disease area, and there was a real opportunity. So we now have a network of 40+ clinical centers in the United States, a clinical registry, a drug in clinical trials right now for a gene therapy, and a lot of progress, although a lot further to go.
Absolutely. No, that's a great preview to this discussion. And I think from there, maybe let's jump into what is the Rare as One project? Tell us about its mission.
Yeah, so I came to CZI. The Chan Zuckerberg Initiative is a philanthropy, a science-first philanthropy with a mission to help cure, prevent, and manage all disease by the end of the century. And they launched a project called the Rare as One Project that is focused on, thank you. Oh, do I have the clicker? Okay, thank you. Focused on advancing research in rare disease. And we were particularly interested in elevating the voices of patients and the incredible work that patient communities are doing to drive forward progress in their disease areas. I think we've heard about that from almost all of the speakers, from all of the speakers today, which has really been great. And so we launched our work with an initial funding opportunity. We had a request for applications, which we were absolutely overwhelmed by. We were a brand new philanthropy. We thought maybe nobody would apply. And we had hundreds of applications from all incredibly deserving patient organizations that were driving forward research. And so we tripled the number that we had originally intended on funding based on the application response rate, but still now after our 3rd round of funding, we're really only at the tip of the iceberg in terms of the need that's out there. So We provide these patient organizations with funding. Our initial funding period was 3 years. Our most recent one was over a 5-year time period. And in addition to providing these organizations with capacity building funding to hire key staff and implement new processes and things within their organizations, we provide them with a host of resources. So science advising, mentorship, trainings. They gather in trainings weekly together around kind of organizational management needs like fundraising, finance and operations, those types of things. We've launched a legal support program with an organization called We the Action to provide them with pro bono legal support. And they gather together in network calls, structured network calls once a month, but then they have many working groups that they've also organized around so they're in conversation with each other pretty much every day to every week at a minimum, I would say. And that has been really incredible. We also gather them in convenings, and the number of synergies and collaborations and things that we've seen come out of this network, we call it the network effect, has really been profound, and I think is really working to accelerate the speed at which these organizations can make progress, both in terms of their organizational development and in terms of the science and the research that they're undertaking.
It's a really exciting project and network that has been built, and hopefully will keep expanding. What can you share with the audience today about what the current span is of the disease areas and therapeutic focus around this network that has been built?
Yeah, so our first, sorry, I keep taking my glasses on and off because my husband sat on them as I went to the airport and they're not working for me very well. But the disease areas that we initially funded they were selected based on what we saw as the real leadership potential of these organizations, and just kind of their mission and how they thought they would benefit from support. And so our initial class of organizations we funded was disease agnostic. And despite that fact, we saw tremendous synergies across them, scientific synergies, and they self-identified these also and formed into working groups like I was mentioning before. And so with our most recent round of funding, we're now funding organizations across 3 classes of disease: channelopathies, ciliopathies, and inborn metabolic disorders, with the specific intention of really trying to optimize what they have in common scientifically. And they are now going through a process together. We just launched this most recent network in December, and they are now going through a process of really sharing about all of their disease areas at a kind of a deep level, and identifying ways that they will work together. And the lists are already incredibly long. So I don't know how we're going to achieve it all, but it's really exciting. And yeah, we're really thrilled about what might hopefully be achieved as a result.
And how is the network thinking about synergies across those disease classes, and how have you already seen where those synergies are benefiting the overall progress forward?
Yeah, so, every call we would be on, we would see in the chat, like, oh, we have that issue too, or I didn't know that about your disease area. It was just like, it was nonstop. We couldn't keep track of it. It was so disorganized and yet so frequent. And so we developed a tool actually to support the organizations identify these scientific synergies. And they completed extremely long surveys in partnership with their researchers and their communities to complete the back end of this tool, where they can now search across a variety of dimensions to find other organizations where they share things in common. And so we have supported them by providing working spaces for them, as I said, to have working groups and things like that around those areas. They have they're holding like their own conferences together now, which has really been, I think, a big step forward in some of their disease areas. And then through these new funding opportunities where we are hoping to be supporting these organizations to work together to develop shared biomarkers, common endpoints, and, you know, other drug repurposing efforts and other things that they are engaging in.
And most of these organizations really started, as I understand it, that are in the network as truly patient, parent-led, and so many of them began that way. What can you say about just, is that still what you see today with new grantees coming in your network, and how has that changed, or hasn't it?
I haven't really seen that change. So, you know, in my children's disease area, when I joined the board of their foundation, it was basically led by one amazing woman with $11,000 in the bank, and you know, a very small board of a few other patients. And as I was saying, it is now really transformed into an organization that's had incredible impact in the field. And there are so many organizations like that NORD supports, the Children's Tumor Foundation here, just totally redefining their fields. And you know, the organizations that we supported to benefit from this capacity building support are all very similarly placed, led by parents, led by patients. We specifically chose organizations that did not have large operating budgets that could really benefit from this initial capacity building support. But what we are seeing, the change that I would say that we do see happening, is that being in a network where they can learn from one another, they are able to grow so much more rapidly. When there is a model that they can follow for, okay, it's really important to hire a person immediately. You may think that you shouldn't spend the money on it, you know, because there's this feeling in this community that we should all be doing this for free, and that all the money should go to research, and we'll do anything to save our children's lives. And yet, if you don't have the capacity to do the work, you really can't do it at the level at which, you know, it could be done. And so being able to learn from other organizations what types of steps they've taken and how it's benefited them has really been tremendously powerful. And they share everything with one another. This is the vendor we used that was good. This is the vendor we used that wasn't good. You know, just everything. They're able to learn from one another and just more rapidly progress. And so I think there's another slide here around our impact report. We funded the patient organizations to do 3 things: to develop research networks within their disease areas, and to convene those communities, and to work together with the research communities to align along patient prioritized shared research priorities. And we didn't know if all 30 of these organizations would be able to do this. As we said, like, we specifically chose scrappy organizations. And not only did all 30 organizations meet those grant objectives and substantively engaged over 3,000 new researchers into their fields. These are researchers that were not previously engaged in their disease areas. 29 of them developed prioritized research agendas. They funded, co-authored over 182 publications during the time of the grant funding, held 144 scientific convenings. This was during COVID, our first round of funding. And we thought, oh, well, that's it. Like, you know, that part of the grant, we just won't require that. But instead, they started holding research roundtables virtually, and, you know, developing new ways of engaging the research community in really meaningful, substantive ways. And then when COVID came to an end, it's over, I think, kind of, they, you know, held in-person convenings and supported over 355 research projects during that time. I mean, just incredible impact. And beyond the grant objectives, we saw them having, you know, tremendous other impact in their field. So you can see the statistics here. I won't read them all out, but, you know, 20 organizations involved in clinical trials. Like, and by involved, I mean playing a significant role in the trial themselves. The 26 of them built a registry. This is out of 30 organizations, you know, 24 developing cell lines, 27 developing disease models. I mean, really, like, building the infrastructure to support ongoing research.
It's really incredible that this network could come together and achieve so much so quickly, and in distressed times, as you know. It really is striking, I think, when we look at the progress that these advocacy organizations have been able to make with science and research. that they have had such impact. And what can you say around just some of the major research work? You mentioned the clinical trials, but the research funding and other impacts that these organizations that started with a low to very little operating budget and the arc of progress, you know, what does that really look like?
Yeah, I think that, I mean, for one thing, the patient voice is really getting centered in research in these disease areas, which is really critical. These patient organizations are bringing together the researchers, and the research is not happening in silos. It's not being duplicated like it typically is. You know, researchers even within the same institution doing similar research and not even realizing that one another is doing the research. I mean, that's just unacceptable in rare disease. And these patient communities are bringing these researchers together and really like figuring out a roadmap. What needs to happen in this disease area to get to a cure? That's our actual, you know, it's the goal of the patients. And I think this is actually really exciting to the research community too. And everyone is benefiting. And so the patient priorities are getting centered. I think that's one key advancement that's hard to mark, but is really critical. And as I was saying, I think like they are really building the infrastructure to fuel research. So they're creating repositories of cell lines and disease models that are open source and people are able to utilize in registries, biobanks, the things that are really fueling the research. And so we, as you can see here, 20 organizations now in clinical trials. I don't think that's the norm in rare disease research. So I don't think 2 out of 3 organizations are at that point. And so I think with this support, it's, you know, we can really see more rapid progress.
And where are you still seeing challenges around these organizations and what lies ahead for them? Wherein are there opportunities to help really continue accelerating and driving what they're capable of doing?
Yeah, so I mean, the biggest challenge, even for the organizations that we're providing support to, is capacity building. They lack the capacity to do what they're capable of doing. I mean, they outperform in every single way. Like they are working on a shoestring and doing what just seems not possible. And yet they need support. They deserve support. They deserve to be paid like the professionals that they are. And they also need it to be able to really support the field. And so I think that remains a real key challenge, fundraising for these organizations. And from a scientific perspective, I think the biggest challenge is really products getting dropped by biotechs. We're seeing so many things getting shelved, and the patient organizations are picking up the pieces when that's happening. We have one of the organizations in our network, CureHHT. They actually purchased the shelved drug themselves that had shown, promise in early studies. They purchased the drug and are the sponsor now, taking it, through phase 2, 3 trials. And that shouldn't be on patient organizations to do it. So I'm not saying like that should be the future, but it is now. It is what is happening in the current climate. And similarly, we see with so many trials failing because of endpoints that were selected that were not, they were imperfect endpoints. And we see patient organizations being really involved now in the early stages of that, partnering with pharma to develop endpoints. One of the organizations in our network, the Rare Respiratory Papillomatosis Foundation, I'm sorry, I hope they're not listening, RRPF, they partnered with pharma to develop an endpoint in their disease area, which was initially rejected by the FDA. And they led a patient listening session. And as a result of that, and drawing from data in their registry, real world data they'd collected in their registry, the FDA ended up accepting the endpoint, said that a randomized controlled trial was not necessary. And they've now seen an 86% reduction in the need for surgeries, which was the endpoint in their disease area. And so You know, this early partnership is really key, and I think patient organizations are really leading the way and demanding this. And I think on the other side, we really need to come and meet them.
And so maybe that's a good segue to how should the biotech community be thinking about engaging with patient organizations more broadly, including those within your network?
Yeah, I mean, I think they can't engage early enough and deeply enough. I think patients can be true partners in this work. I mean, they are one of the organizations that we support, the Chordoma Foundation, actually launched its own lab and is really creating the tools to support preclinical research. And so I think they can be actual scientific partners in some cases. They are also partners, as I was saying, in thinking about endpoints and thinking about clinical trial development, you know, throughout the work. They're playing key roles, and I think that engagement can't be early and deep enough. I would also encourage the biotech industry to really partner with patient organizations in thinking about related disease areas. Like, we're very interested in bucket trials and the identity, you know, there's so many rare diseases which could benefit from similar approaches, and yet biotech frequently, I think, is, you know, zeroed in on one target and is not thinking across other related disease areas. And, you know, we have 10,000 plus of them. Like, how many can we tick off in a go would be great. So
I know you mentioned that one thing that could be so helpful for the patient organizations to be thinking about is they look across then at engaging with biotech as well. When we spoke previously, is just helping suggest areas of focus that often the patient and family communities really are so close to the science and could be really helpful in informing where the research focus, where those limited even biotech investor dollars get placed in research. So
yeah, absolutely. I mean, the patient organizations are so close to these research communities because 99% of the time they've built them, and they know the unpublished research. They know, you know, they're having daily conversations with the researchers in their network and with other patient organizations. And so I think there's, you know, a wealth of information in these communities, and, you know, 100% eagerness to collaborate.
As Rare as One looks ahead to 2025 and beyond, your next cycle, when that comes of grants, what are some of the key priorities and things that are top of mind?
Well, for one thing, I think that we really feel that, not that this should have had to have been proven, but I hope that we are really making the case that patient organizations are playing key roles in research, and really wanting to identify other funders and other partners in this space to join forces with us, to really uplift these communities and the work they're doing. So that's one thing we'll be working towards. Secondly, I think we'll really be zeroing in on this direction we're already moving in terms of really supporting the identification of synergies across rare disease areas. I don't think there's enough that's been done from that perspective, specifically from a basic biology perspective, but you know, across other dimensions as well. And so that's going to be a continued focus for us. And I think also as we think about how that intersects with other work that we're doing. And then we'll continue to work in the other areas that we work in the Rare as One project around diagnosis, which is a key issue. The vast majority of rare disease patients are undiagnosed, around disease characterization and translation.
Excellent. Well, I want to open it back up for if there's questions here in the room for Heidi about the Rare as One project, their work with patient organizations. We're getting you a mic.
Hi, Heidi. So Goodwin, of which is a beneficiary of this program, and I think this is an amazing project. It's very innovative, and it's a very entrepreneurial, you know, to have this sort of grassroots effort. I completed my patient registry. I filled out my form about my child. And I think there's an opportunity for you and probably Nord to get together and go to the new administration and say, you know, we've created these young patient advocacy groups. They've collected a lot of data on these really, really special people. And, you know, we think, you know, we should be all these patients and these conditions should have ICD-10 codes. And we should collect their history because I'm sure that's what these parents want, right? And I think you two should get together and go because, you know, I spent a lot of time in software industry and data, you know, you've collected a ton of amazing data that needs to sit in a registry. It needs to be made more available to the biotech community. And if you want innovation, you know, researchers want data, right, to be able to look at. And so I think that could be a really positive next step for this. And you know, I think this is an amazing program. You should double it, triple it, you know, get all, because you've done so much.
So too.
Yeah, no, you've done so much in such a short period of time, I think, with this. You know, I've lived it and seen it. And so, you know, it made an impact for us. So I just wanted to advocate for moving it forward, you know, taking what you've learned to the next level. Because I think it could be a great model for how industry and innovation in biotech could work. Yeah, and you know, because a lot of the things you're talking about are, you know, are learnings, and, you know, early learnings, but you've planted so many awesome seeds along the way, you know, to grow.
Thank you for sharing that, David. I guess I maybe didn't really say that, you know, part of our theory behind the Rare is One network is that it would really inform all of the work that we do in the Rare is One project, which is our broader work, and really wanting all of that to be driven by the patients. So not directly, but by our learnings from the patients, we would, you know, then engage in these other efforts within the Rare is One project. And so I really appreciate your highlighting that as an area for us to think about. Certainly open sharing of data is absolutely key and a key priority for us, or actually across BCI. And so let's talk further about that. I will definitely be speaking with Pam. We consider Nord a real partner, and I think that, yeah, I really appreciate your sharing of that idea.
We have one question from Jack on this side of the room. Go ahead, Jack. Oh, yeah.
It's more of an offer because I agree with that completely and would like to have you and Nord join the next meeting or the meeting after that of my Washington Health Innovation Council, where we're bringing administration officials in, but also want to propose going to the Office of the Secretary at HHS and suggesting a meeting where you present this and you have various members of the new administration per your comment from the different agencies, and not only the FDA, but under the umbrella. So in my time in 2 different administrations, we never had a meeting like this. It was individual patient groups on a topic like drug pricing, but this would be a unique, and I think at the beginning of an administration, a very good meeting.
Thank you for that offer. I will talk with you after.
Excellent. Well, seeing no other questions around the room, thank you so much, Heidi, for being here, sharing
Thank you
this
so much for having me.
amazing work.